Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Ms. Mihiraa. How are you feeling today?
Well, I'm still not feeling great, to be honest. I've been experiencing these symptoms for a while now, and they're really starting to affect my day-to-day life. My face feels stiff, especially on the right side. It's like I've lost control of the muscles there, and I can't close my right eye properly. It's very uncomfortable and even a bit scary. Eating is difficult because my mouth droops slightly on one side, and I'm drooling without even noticing. Speaking has become challenging too. People have trouble understanding me sometimes.
I understand that must be frustrating. How long have you been experiencing these symptoms?
It started about a week ago. At first, I thought it might just be stress, but it's not going away. In fact, it seems to be getting worse. I thought it might be a stroke, but I don't have any weakness in my arms or legs. And I've noticed no changes in my thinking or memory.
From what you're describing, it does sound like it could be something other than a stroke. Based on the facial muscle weakness, difficulty closing one eye, and the fact that these symptoms developed suddenly, it might be Bell's palsy.
I've heard of that, but I really don't think it's that serious. I mean, I don't have any severe pain or fever, just the drooping and difficulty talking. Can it really be painless?
Yes, it doesn't always come with pain, although some patients do report discomfort. It's a condition where the facial nerve becomes inflamed, and this affects the muscles on one side of your face. It's usually temporary, but it's important to get it checked early. Have you been on any medication recently, or have you had any other significant medical issues in the past?
Well, I take antihistamines for my allergies, but that's about it. I've been on cetirizine for maybe 2 years now. I don't have any chronic conditions that I know of. Although, I did have a bout of sinusitis a few months ago, but that cleared up with antibiotics. Other than that, I'm generally healthy.
Thank you for sharing that. Do you have a family history of any neurological or autoimmune conditions?
Not that I know of. My parents are relatively healthy, and so are my siblings. My father has high blood pressure, and my mother has diabetes, but nothing related to nerve issues or anything like that.
All right, good to know. Have you tried any treatments for your current symptoms? Anything over the counter, or perhaps home remedies?
I've been taking ibuprofen because I thought it might help with the swelling or inflammation, but it hasn't done much. I also tried using warm compresses on my face to relax the muscles, but that didn't work either. Other than that, I've just been hoping it would go away on its own.
It sounds like you've done what you could. Based on your symptoms and what you've told me, I recommend doing a few medical tests to confirm the condition. We'll likely do a physical examination, and I'll refer you for an MRI scan to rule out other possible causes like a tumor or stroke, even though it seems less likely.
Do you think the tests are really necessary? I was hoping it would resolve on its own.
It's always better to be thorough. The condition usually resolves in a few weeks to months, but early treatment is important, especially if we can confirm the diagnosis. Steroids like prednisone are often used to reduce inflammation, and antiviral medications might be prescribed if there's suspicion of a viral cause.
I'm not sure about that. Aren't there a lot of side effects?
Yes, steroids can have side effects, but they're usually short-term. If you start treatment early, it can really help with your recovery. The main goal is to reduce nerve inflammation and improve your muscle function before the condition worsens. We can discuss the details of the treatment plan once we get the test results.
All right, I suppose that makes sense. I'll do the tests.
Great, I'll schedule you for the tests as soon as possible. In the meantime, keep doing the facial exercises I'll show you that can help maintain muscle tone.
Thank you, I really appreciate your help.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good afternoon, Mihiraa. I understand you're here due to some throat-related issues. Could you tell me more about what brought you in today?
Good afternoon, doctor. Yes, for the past 3 or 4 days, I've had a sore throat. It started off as mild irritation, but now it's become quite painful. I'm also finding it hard to speak. It's really uncomfortable.
I see. How would you describe the discomfort? Is it more of a sharp pain, or is it more like a scratchy, dry feeling?
It started as a scratchy throat, but now it feels more like a burning sensation. I also feel hoarse, like my voice is weaker and sometimes I can't speak clearly at all. My throat feels dry no matter how much water I drink. I've tried to rest my voice, but it's not helping much.
That sounds uncomfortable. Are you experiencing any other symptoms, such as coughing, fever, or difficulty swallowing?
Yes, I've had a bit of a cough, though it's not constant. Swallowing has become quite painful too, especially when eating. And I've noticed a mild fever since yesterday, but nothing too severe.
Okay, so let me ask, how has this been affecting your daily activities?
It's been tough. I'm a teacher, so I need to talk all day. But with this pain and the hoarseness, I've had to take some time off. I can barely get through a conversation without my voice breaking. Plus, the fatigue from the fever is making it difficult to concentrate. It's really frustrating.
I can imagine it's quite distressing, especially with your job requiring so much vocal work. Let's talk a bit more about your health background. Have you had any previous issues with your throat or voice, perhaps something like laryngitis?
No, nothing like this before. I've had the occasional sore throat with a cold, but nothing this bad.
What about your family history? Any conditions that run in the family, like throat issues, allergies, or respiratory conditions?
Well, my mother had asthma, but none of us kids inherited it. My father, though, did have scarlet fever when he was young, but he recovered without any lasting issues.
Thank you, that's helpful. Based on what you've told me, I initially suspected laryngitis, which is an inflammation usually caused by overuse, irritation, or infection. But considering your other symptoms, especially the fever and painful swallowing, I'd like to investigate further. It could potentially be scarlet fever.
Well, my mother had asthma, but none of us kids inherited it. My father, though, did have scarlet fever when he was young, but he recovered without any lasting issues.
It is more common in children, but adults can contract it as well, especially if it develops as a complication from a throat infection like strep throat. The signs, such as a sore throat, fever, and sometimes a rash, can overlap with what you're experiencing.
I see. So how can we be sure?
To confirm the diagnosis, we'll need to do a few tests. First, I'll do a physical examination of your throat and look for any signs of redness or swelling. Then, I'll take a throat swab to check for a bacterial infection. We might also do a blood test to look for any markers of infection.
Okay.
That is the end of Part A. Now check the answers.